Hey everyone, thanks for tuning in and welcome back to another Carnivore Conundrum. Stephen here with Team Euphoric, and today I'm going to be explaining why you may be experiencing paralysis despite never having suffered a spinal cord injury and what you can do about it.
Today, we're diving into a critical and often misunderstood topic, paralysis that occurs without a spinal cord injury. You might think that paralysis is always linked to damage in the spinal cord, but there are numerous other conditions and factors that can lead to paralysis. We'll explore the underlying causes, the role of nutrient deficiencies, and effective solutions tailored to your unique biochemistry. The first thing to investigate as a potential cause of paralysis without a spinal cord injury is a stroke. A stroke occurs when blood flow to a part of the brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. This can lead to paralysis on one side of the body, known as hemiplegia. The severity depends on the area and amount of brain tissue affected. Second is cerebral palsy. This neurological disorder is caused by abnormal brain development or damage to the developing brain, often before birth. Cerebral palsy can result in varying degrees of motor impairment, including paralysis, depending on the severity and location of the brain damage. Third is multiple sclerosis, or MS. MS is an autoimmune disease that affects the central nervous system, damaging the protective covering of nerves, the myelin sheath. This can disrupt communication between the brain and body, leading to paralysis in severe cases. Fourth is trauma and head injury. Trauma or head injury can damage the brain or nerves that control muscles, leading to paralysis. Even if the spinal cord remains intact, damage to the brain or peripheral nerves can cause loss of muscle function. Fifth is cancer. Certain cancers, particularly brain tumors or tumors pressing on nerves, can cause paralysis by disrupting the normal function of the nervous system. Sixth is Lyme disease. This tick-borne illness can lead to neurological complications if left untreated. In some cases, Lyme disease can cause nerve damage that results in paralysis. Seventh is medications. Certain medications, especially those that affect the nervous system or muscles, can cause paralysis as a side effect. Examples include some chemotherapy drugs, antipsychotics, and medications used to treat seizures. Eighth is poor posture and nerve entrapment. Chronic poor posture can lead to nerve entrapment, where nerves are compressed or pinched. This can cause paralysis, particularly if the affected nerves control motor functions. Ninth is toxicity. Exposure to toxins, whether environmental or from certain medications, can damage the nervous system, leading to paralysis. Mercury poisoning is one example of a toxin that can cause such effects. 10th is radiation. Radiation therapy, particularly in the treatment of cancer, can sometimes damage nerves, leading to paralysis. This is especially true if the radiation targets areas near critical nerves. Last is arthritis. Severe arthritis, particularly in the neck or spine, can lead to nerve compression, which might cause paralysis. This is usually gradual and can be managed if detected early.
Sorry, but I have to interrupt this video to ask for your help. These new videos aren't cheap to edit, so if you're liking the new style, then consider becoming a member by clicking on the join button down below this video. It's only $5 per month and will really help with the video editing budget. Plus, you'll get a ton of other perks like ad-free videos, early access to videos, and complete access to hundreds of member-only videos. Now, back to your regularly scheduled programming.
We must also look to the possibility of nutrient deficiencies such as cobalamin or vitamin B12 and potassium. Vitamin B12 is crucial for nerve health and the production of myelin, the protective sheath around nerves. A deficiency can lead to nerve damage and, in severe cases, paralysis. This is particularly a risk for vegans, older adults, and those with certain digestive disorders. Potassium is essential for proper muscle function. Low levels of potassium, or hypokalemia, can cause muscle weakness and paralysis. This deficiency is often linked to excessive loss of fluids, certain medications, or an inadequate diet. Now that we've discussed potential causes and nutrient deficiencies, let's talk solutions. Physical therapy is often the first line of treatment for paralysis. It helps to restore movement, improve strength, and prevent muscle atrophy. A tailored physical therapy plan can significantly improve outcomes, especially when started early. One particular modality that I use in my physiotherapy clinic that has been particularly effective is the Eldoa method. The Eldoa method is a series of postural exercises designed to create space within the joints, particularly in the spine. This can help alleviate nerve compression and improve overall spinal health, making it a valuable tool for those suffering from paralysis not linked to a spinal cord injury. It's crucial to remember that every individual's body reacts differently to various conditions, treatments, and nutrients. This is where the concept of biochemical individuality comes into play. When addressing paralysis, it's essential to consider your unique biochemistry, nutrient deficiencies, the effectiveness of physical therapy, and responses to specific exercises like the Eldoa method can vary greatly from person to person. A personalized approach is key to finding the right balance of treatments and nutritional support. This might involve working with a healthcare professional to test for nutrient levels, tailoring your diet, and selecting therapies that align with your body's specific needs. Paralysis without a spinal cord injury can be alarming, but understanding the possible causes and taking a personalized approach to treatment can lead to significant improvements. Always consult with a healthcare professional to explore the root causes and develop a plan that suits your unique biochemistry.
Thanks for sticking around until the end of the video. Be sure to like, share, and leave a comment as it'll help the algorithm. And if you enjoyed the content, show your support by subscribing to the channel by clicking on the icon in the bottom right corner. And if you really want to show your support, then consider becoming a member by clicking on the icon in the bottom left corner. These new high-quality videos aren't cheap to edit, and the $5 membership will really help with the video editing budget. You'll also get access to a ton of exclusive perks like early access to videos and this program design lecture playlist in the top right-hand corner. And if you want to learn how to do a one-armed pull-up, then check out the playlist on the top left corner.